Good morning, everyone. I'm Chuck Krutzinger. I'm CEO of Countermind, and we are the makers of the technology that we're going to demonstrate today.
And my name is Melissa McClung. I'm with Denver Public Health, and we'll be talking about our HANDY app, which stands for Handheld Automated Notification for Drugs and Immunizations. And we'll be talking about how we use this app to streamline data collection and registry entry during mass immunization and prophylaxis events.
A little bit about Countermind. Countermind is the maker of mobile intelligence products for businesses.
And Denver Public Health is part of Denver Health, a large healthcare provider that serves the city and county of Denver. We include the Denver Center for Public Health Preparedness. We offer clinic and community-based immunization services and also include a strong public health informatics group. And our project team is comprised of members from these groups who bring their expertise to the HANDY project.
Okay, I want to talk about the need for accurate and timely vaccination data, but I probably don't need to convince this audience that there is a need for that kind of data. We all know that when things go well, accurate data helps families and their healthcare providers keep track of what vaccinations have been given and when others are due. And when things don't go well, that's when we need this data to track back to specific vaccines or manufacturers or lot numbers to make interventions. Those interventions require accurate and complete data. However, the CDC reports each year that there are about 30,000 adverse reactions recorded in their vaccine adverse events reporting system. And though that represents though it only represents a small, less than 1% of all the vaccinations given, there are 3,000 to 4,000 plus adverse reactions that are considered serious, which they define as resulting in permanent disability, hospitalization, life-threatening illness, or death. But just when the importance of that accurate data comes into play, that's when we find out that 20% of those reported reactions are missing a lot number. And worse yet, it turns out that the immunization information system records are also missing lot numbers in more than half the time, according to the CDC. So HANDY is a technology that we're going to demonstrate today that can easily, quickly, and cheaply remedy this situation and also reduce labor costs at the same time. As more background, I'd also like to just give a little introduction to something Melissa will talk more about later, but it's the FDA's Mini Sentinel pilot project. Another vital role that immunization data plays is to act as a sentinel, revealing troubling patterns early on regarding vaccinations. The FDA is setting up this program to take advantage of modern big data analytics technologies to develop an active surveillance system for monitoring drugs and other regulated medical technologies using electronic data from healthcare information holders such as healthcare providers and insurance companies. Using sophisticated analytics, they'll be able to link regulated medical products to outcomes as a means to identify causes of adverse events before they've even been diagnosed by others. Right now, data collected by HANDY is being used as a data source for Mini Sentinel data monitored by the FDA. Melissa will go into more detail about that in just a little bit.
So back in 2009, 2010, Denver Public Health, like many other local public health departments, were asked to mount major H1N1 vaccine campaigns. And through that process and through that effort, we really noticed that there were some issues that needed to be addressed to conduct mass interventions. The first thing was how to track the vaccine. At that time, there was a limited number of doses of the vaccine, and so in order to distribute those wisely and correctly, and in order to target those priority groups, it was difficult to track the vaccine and also to track who was being vaccinated. Especially, there was no data in real time. And then also, many health departments used paper-based forms for patient registration. Denver Public Health used a scannable form that would use optical character recognition to try to reduce that paper burden. But still, paper forms were definitely slowed down the process for registration. And then often, after these vaccination events, we were stuck with these stacks of paper that needed to be entered to get that vaccination records into some sort of database and then passed on to the registries, which was extremely resource intensive and often incomplete and inaccurate. And in our case, those scannable forms that we hoped were going to improve the process actually failed miserably. So what we decided to do to address these issues was to embark on a project. Our main goal was to support efficient public health immunization and prophylaxis activities through the rapid collection and transfer of standardized data. We knew we wanted to utilize mobile technology in order to accommodate various clinic environments. We knew that these clinics would probably be held at the health department, but we may also want to conduct them out in parking lots, schools, or sporting venues. In order to reduce the amount of data that's collected manually and entered through a mobile device, we wanted to take advantage of scanning technology so that driver's licenses or other forms of identification could be scanned in. And then also, we certainly realized the importance of adhering to HL7 messaging standards so that once the data was collected electronically, it could then be converted into HL7 and sent on to designated data repositories. So as a result, we contacted Countermind and used their MI Clinic product to create DPH's Handy, or Handheld Automated Notification for Drugs and Immunization System. Handy is an iOS mobile app. It runs on iPod Touches, iPhones, and even an iPad. We typically use iPod Touches. Handy also includes a web-based administration tool or manager, which we fondly call the Handyman. And it also has a server-based database. As I mentioned, the scanning technology on the previous slide, the iPod Touches fit into what we call a sled, and it's a scanner that can be used to scan magnetic stripes on the back of driver's licenses and also scan 1- and 2D barcodes. We also use a mobile printer to print patient-specific barcodes. So as a patient's data is entered into the Handy device, a unique ID is created for that patient and then turned into a one-dimensional barcode. So we've used Handy in several different venues. The biggest is that we've used it during Denver Health's mandatory employee flu campaign. We've used it there for about the past 3 years. The first year we piloted it and then took it used it much more large scale in 2012 and 2013. Employees at Denver Health pre-register on the Denver Health intranet, and then during the mass clinics or if there's roving carts or at other areas, employees present at the vaccination clinics. Handy users scan their employee badges. The vaccinator and the injection site is recorded, and then they're free to go. So the whole process can take easily under a minute. In 2012, we used Handy to vaccinate approximately 3,000 employees, and that was we just used Handy during the week of mass clinics that year. And then this previous year, we expanded it and were able to vaccinate about 5,700 employees during the week of mass clinics. And then also we had Handy devices stationed out in our community clinics and other Denver Health divisions, such as the paramedic division and the Rocky Mountain Poison and Drug Center. And overall, this has really streamlined the whole flu campaign process. It's become so much more efficient, it's highly accurate, it's created a great paperless system, there's no data entry burden, and then also it's really provided some feedback in real time. Managers are able to track which of their employees have been vaccinated by just logging into the Denver Health intranet and just checking the status. So it really gives some great feedback. And then as Chuck mentioned, Denver Public Health is participating in the FDA-sponsored Mini Sentinel project. This is a collaboration between the FDA, Harvard Pilgrim Healthcare, Kaiser Permanente Colorado, and NACHO, the National Association of City and County Health Officials. And we're trying to assess the ability to conduct adverse event surveillance following a medical countermeasure event. And to do this, we are conducting a field exercise where Kaiser is using Handy during patient registration in flu clinics. We enhanced Handy to be able to capture health insurance information. So Handy now takes pictures of the health insurance member ID card. And then once Handy is used to collect the data, it is then linked to the internal Kaiser patient database and then can be used by the Mini Sentinel database. And from a Handy perspective, this project demonstrates that mobile technology can support timely adverse event surveillance. And also, this is the first time that Handy has been used outside of Denver Health. So we were really happy with Kaiser being able to implement the whole Handy system and use it without additional assistance from us. We've used Handy in a few other applications. We used it last winter during Denver's Child Care Worker Pertussis outreach. We sent nurses out into the field with Handy devices, and they went to child care settings, training, other types of child care worker places, and vaccinated about 400 child care workers. The nurses then brought the Handy devices back. We synced the data with the server, converted it immediately to HL7, and sent it directly and electronically to the Colorado Immunization Information System, or SIS. So again, there was a paperless system, and there was no data entry after the fact. We've also used it in sort of some non-traditional ways, or ways that weren't necessarily anticipated when we designed it. But Denver Health Center for Occupational Safety and Health used Handy during its annual firefighter TB testing. So Handy was used to register the firefighters and reduce the data entry. We did about 350 firefighters last May. And then we've also used it to keep our emergency preparedness staff up to date on its use. So we've used it both at a staff retreat lunch dispensing exercise and also for a conference registration. Overall, Handy users really like it. They report that data entry is easy, straightforward, intuitive, and fast. For the most part, we train our users just before the event, so we use just-in-time training. And so we were really happy that they feel that it's intuitive and fast and easy to pick up. For the most part, everyone strongly agrees that Handy is a good way to enter data, and we'd use Handy again to collect data. So before we demo it, I just wanted to kind of describe it a little bit more. When we were designing Handy, we wanted to create a very flexible tool. We realized that clinics are going to be conducted in different ways and in different venues, different sizes. So we divided it into a 3-station workflow. And these stations can be used all together with for one Handy user, or they can be separated into 3 separate Handy stations. The first one is demographic, and that's where we scan driver licenses and other forms of ID. That's also where the patient's unique barcode would be printed, and then the patient would take their barcode and proceed to station 2, which is where they're asked a series of customizable health questions related to the intervention being delivered. If they're eligible, they will then take their barcode, proceed to station 3, which is where the vaccine or the drugs are actually given out. And this is also where we could provide proof of vaccination or drug instructions. We've also collaborated with the Larimer County Department of Health and Environment, and they have a system called FEWR, or their Public Health Event Web Registration System. This allows a patient to go online and register for an event, maybe for a time and a day and a location. And then we've worked with them so that now the FEWR system can generate a Handy compatible barcode that's unique for that patient. So the patient could, at their home, register, print out their barcode, and then come to the actual intervention event and skip station 1, but then proceed right to station 2 and 3. So this picture kind of shows what I've kind of talked about with the 3 stations. And then let's start over there on the right, and there's a red box with the Handy server, or the handyman. This is where before an event actually occurs, all of the predefined data would be entered. So the location, the time, vaccinators, the vaccine and the drug information, the Handy users would all be put in before the event. So anything that's known up front would not have to then be entered at the event, and this helps definitely streamline the data collection process. Then that data is downloaded on each Handy device. That second column under red box with Handy application at the top is where you'll see the station 1, and that's where the patient is registered and their driver's license is scanned. Any additional information would be entered, such as phone number, email address, children could be added at that point. The barcode, the unique barcode sticker is printed. The patient then goes on to station 2, where they're asked a series of health questions. Moves on to station 3, where they're given the vaccine or their drugs are given to them. We would record the vaccinator, lot number, and injection site at that time, and then we can print patient-specific information. All of that data is then aggregated at the server level, pushed up to the Handy server and aggregated, converted to HL7 if needed, and then sent on to immunization registries if applicable, or to other designated data repositories. And then, as I mentioned too, we do interface with the viewer system. That's optional, but it does print that unique barcode sticker that then can be presented at station 2. Like I mentioned, we wanted to develop a very flexible tool, so we also Handy can also operate in a variety of network environments. We have 3 different network topologies. First of all, we can work in a Handy dedicated network. This is where we would go into a site or go into a clinic with our Handy server on a laptop. We'd bring in our own Wi-Fi access point, and then the devices would talk to the server through that Wi-Fi access point. We can also put Handy on an existing network. This is what we've done at Denver Health for the flu clinics, and this is where we put the server up on the Denver Health network. We use their Wi-Fi to connect, and we don't need our own Wi-Fi access point. And then also, we certainly recognize that devices will need to be used in the field where there's no Wi-Fi. So if that's the case, then the devices just store their encrypted data on the device until a connection is established, and then this data is synced with the server. And this is what we used when we did our Tdap campaign. We sent the nurses out in the field with their Handy devices, and then when they came back to the public health building, we synced at that point and then transferred the data off of the devices. All of the data collected by Handy is encrypted with the industry standard AES 256, and as an extra layer of protection, all of the devices use a mobile device manager, and we use GOOD. And this provides the ability to wipe the devices should they become lost or stolen. This picture just kind of shows you from a graphical standpoint of what I just described. Over on the left, we have the Handy devices. In the box in the center, we have our connection options. The private Wi-Fi network, an existing network, or no connection. The data is then pushed up to the Handy server, then converted into HL7 or another format, and then can be sent on from there to registries or other databases. And now, Chuck will give us a demonstration.
Okay, if you'll give me just a moment, I will be able to share the iOS screen with you guys. 1 second. Sorry. Okay, hopefully by now everyone can see the screen of this iPod Touch. This is the Handy login screen when you first launch the app, and as you'd expect with a healthcare app, you have to provide a login. This is a demo, so my login's not very sophisticated, but you can choose at this point what location you're going to give your campaign at. I'm going to log into DPS Head Start, and then you see the basic choices you have in the application. There are the 3 workflows that Melissa already described to you across the top there, the greet station, the questions for screening to make sure they're qualified for the vaccine, and then lastly, the vaccination station. And then there's a 4th workflow on the 2nd row that combines those 3 into a single workflow for smaller settings where you don't need to have the work so distributed. However, the demo is much easier to give with the combined workflow, so I'm going to go through the one that says complete back workflow. So when I open it, you're at the greet station screen. So this is what you'd see if you open the Greet Station workflow as well. And this device, now I'm going to scan the barcode on the back of my driver's license, and up comes my name, my address, my age, my birthday, my gender. Then we've added some optional fields here that are customized for Denver Health to make some race choices. And also this is where you can see at the bottom they capture information about the insurance provider. And some of the new enhancement is to allow them to photograph an insurance card. So here's my own health insurance card, which I've taken a photo of the front, and then I would flip it over and take a picture of the back. And then that can be used to read by an operator later to collect the actual insurance information. So once that was collected, if this were just a Greet Station, along the bottom there would be a print button beside the next button. And that would print the unique barcode that Melissa described to you, which then I would take to the other stations. Given this is the combined workflow, I don't need that, so I'd go next to the next part of the workflow, which is the screening stations, which you would see at the second station. In this case, this campaign configured for only 4 questions, and as you can see, there are different kinds of questions. The first and the last are yes/no questions, so am I sick today? No, I'm not. So I'll press no. And then the next one is have you had a severe reaction to vaccines or latex in the past? And that's a multiple choice, so I can actually, it's a single choice. I can choose any one of these answers, but not more than one. So, I stand corrected. You can choose more than one on this one. So I chose neither. I also haven't had any of these problems. But you can also configure a question to only accept one of the multiple choice answers. That one didn't record any. Okay, and lastly, am I pregnant? Most of you probably guessed by now the answer to that. Then we would go to the third station where you would receive your vaccine. If these stations were operating independently, this is where they would scan my unique barcode to pull up my name. Now, you can data enter each of these fields manually, but we also have the ability to scan barcodes and populate a lot of fields all at once, if it cooperates. Well, I'm having trouble with that barcode scan today. But you choose the lot number for the vaccine, the manufacturer, a dosage, in this case there's only one choice, which injection site, left or right deltoid, and then who gave the shot, and then save it. And now the data is has just now been synchronized to the server, which in this case is up in the cloud, and we're ready for the next patient. So that's basically it. That's the workflow for taking a patient through a vaccine. There are a couple more options here for synchronizing data when you've been working without a network connection, and also to load different campaigns using the Clear Campaign button. So that's it for this, and we'll go back to the presentation.
So of course we've learned a lot through the development and use of Handy. We certainly recognize the importance of involving partners and establishing relationships early in the project. They definitely tend to go a lot better if you do that. We sort of tried not to involve the Denver Health IT department, not that we didn't want to, we just didn't want to burden them. We thought we could kind of handle it on our own. However, putting Handy on their network and using their network, really, we should have involved them a little bit earlier to make that process go a little bit more smoothly. We now appreciate the complexity of mobile device management and security. We have like a fleet of 14 devices. There's different iPod versions, there's different scanner versions, there's different firmware versions. There's just a lot going on, and so it takes a little bit more time and effort than we initially thought it would up front. Even just getting the devices all charged and keeping them charged during an event, takes some work. We really appreciate Countermind's investment in Handy, and we are very grateful for our good relationship with them. They really are very supportive and responsive, and so we really value the importance of a good relationship with the software vendor. And as I mentioned, we for the most part use just-in-time training when we train our Handy users, but we have recognized that users without previous mobile device experience or those who don't use smartphones would probably benefit from more time using Handy, just to get some more practice in before faced with a line of patients would help them feel more comfortable. In terms of next steps, we would like to expand the underlying data model in order to use Handy to accommodate a wider range of services. We'd like to use Handy during Denver Health PPD testing, which all employees have annually, so it would be great to be able to use this to collect that information and keep track. We'd also like to put Handy devices in our healthcare worker outreach efforts. Denver Health utilizes patient navigators that go out into the field, and we think this would be a great tool for them to be able to use to collect their data. And then also there's been some sort of non-traditional uses of Handy that have been proposed. There's a county in New York who would be very interested in using Handy for both human vaccination, but also are interested in it for pet vaccination. We'd like to enhance the information capture functionality that you just saw. We'd like to maybe explore optical character recognition so that the data on those member ID cards could actually be pulled off and stored in the database. And then we'd also like to enhance our HL7 message generation feature. We'd like to be able to send immunization records directly from the devices to a registry, and we also are very interested in pursuing linking Handy data to electronic health records. And then also the scanner device, or the sled that we use, tends to be somewhat pricey, and so we're researching the use of just using the device camera itself in order to scan the barcodes and the QR codes, and thereby replacing those expensive scanner attachments.
And then an example of the flexibility of the underlying MI Clinic technology on which Handy was built is shown by how the Donor Network of Arizona has adapted it to the process of registering organ donors. Donor Network of Arizona is an organ procurement organization, and one of their major responsibilities is, of course, registering organ donors. They learned about Handy from the CDC blog article that Melissa wrote and posted, and approached Countermine with the idea of adapting it to their needs. Their goal was to shorten the time to register a donor and therefore register more donors because it would be so fast and easy, while at the same time eliminating their paperwork or delays that might result in a missed donation. But I'm going to let them explain it to you. You can watch this video, by the way, later on YouTube if you want to see it again by using that link right there. But I'm going to show you the video real quickly.
Registering as an organ donor is a great way to give hope and spread generosity. You can register to be a donor at your local motor vehicle division, online at donatelife.net, or by filling out a form at an event. Arizona has launched a new technology to make it faster and easier to register as a donor, all with a simple swipe. Let me show you how easy Swipe to Donate Life can be. All you have to do is swipe your ID through one of our handheld scanning devices, press consent, and you're automatically submitted to our registry. Swipe to Donate Life has made registering on-site at events and in the community easier than ever. Swipe to Donate Life holds great promise for Donor Network of Arizona and other organ donor organizations by taking the paperwork and data entry out of the registration process. This technology is possible thanks to Countermine's mobile intelligence platform. With Swipe to Donate Life, we can ensure accuracy in our registry to make sure that no opportunity to save a life is lost.
So, with this little gizmo right here, we can swipe your driver's license. All your information, all your pertinent information goes in there except for your email address. And if you're already registered, we'll find out immediately. And if you're not registered, we can input all your data and you can become an instant donor.
help save lives today by going to donatelife.net and registering as an organ donor in your state. Please take this opportunity to be a hero.
Okay, I hope you were able to hear that. I know it didn't come through for those listening on the phone.
So before we move on to questions, I'd just like to acknowledge my Denver Public Health colleagues, Art Davison, Chuck Smedley, and Dean McEwen. HANDY has been supported through Denver Public Health, CDC preparedness, and FDA funding. NACCHO awarded HANDY as a model practice in 2012, and HANDY was a large part of DPH's receiving NACCHO's Large Health Department of the Year award in 2013.
And lastly, there's our contact information if anyone wants to follow up. And at this point, we're ready for questions and answers.
Okay, do we have any questions?
I don't see any.
Okay. Last call for questions, last chance. No? Okay. Well, thank you guys for presenting today. I really enjoyed the demonstrations, and the video came through on my computer. I hope it did too. If it did not, I do have a link in with the survey email that will be going out. So look for that. Please remember that you do have to fill out the survey for your CHESS or MCHESS credits. And I'd like to thank you guys for presenting today. It was a really good webinar.
Thank you. We enjoyed it.
Thank you.
Thank you.
Thank you. Please stand by.